No amount of alcohol is okay during pregnancy, and for expecting mothers, this is one area where their addiction has visible effects on another life. Judith Pace at Mount Regis discusses the dangers of fetal alcohol syndrome and how you can seek help before you decide to conceive.
Fetal alcohol syndrome is actually a group of different effects, damages that can be done when a mother drinks during her pregnancy. It's on all different levels, from very, very severe reactions such as, terrible, terrible kind of outcome for that child, to just some minor ones. But they're not things that can be fixed. So that makes it a very difficult thing for the baby as well as for the mother, who obviously may have some guilt and concern and worry about, did I do this?
And how prevalent is this as a problem?
The CDC is actually watching this now, and the problem itself, we know that there's about 125,000 women actively drinking during pregnancy. So the warning and the best advice is to not drink at all. There are groups, thank goodness, support groups for people who have children with fetal alcohol syndrome. And, that's important to know and to be able to get the help that you need.
And we've talked a lot here about how addiction affects other people, but this is probably the most direct way an addiction can affect another life.
Definitely, definitely. We know that alcohol and drugs is a family problem. It's not just the person who has come in for recovery or the person who's out there using. But in this situation, everything that the mother consumes, the baby consumes. So if mama's drinking alcohol, the baby is too. The fetus is undeveloped, it's immature, it can't handle the alcohol. And the alcohol actually replaces the amount of oxygen that's getting through to the fetus, which is going to cause problems with brain development, can be very, very severe.
So one of the things that you guys do here at Mount Regis is that you try to you treat people with their addictions before. So hopefully a mom could come in here and get treated with her addiction before she gets pregnant.
That would be the best case scenario. Yeah, it really would be. I think that the awareness out there, mothers becoming aware that this can be a problem, is so important. And yes, not being intimidated or not being frightened to come in and say, I think I may have a problem. And, I'd really like to have children. What can I do to make sure that I have the healthiest outcome for my child?
And the statistics are out there that this is a huge problem among women, but a lot of them don't seek treatment.
A lot of them don't seek treatment. If you think about the fact that in the first trimester, maybe the first 8 weeks to 12 weeks, this woman may not even know that they're pregnant, and they may be drinking during that period of time. Not unusual for that, but it's so vital because those first 3 months are the major time of development. The good news is the sooner you find out that you're pregnant and you seek help, the less damage can be done. This takes working with the community, getting information out there, making sure there's no stigma. There should not be stigma involved in this. It's non-judgmental. So what we would like to do is hopefully work with the OB-GYNs, letting women feel comfortable going to their doctor and saying, okay, I do drink. I did notice when I was doing more research on it that more doctors will ask about smoking habits and not ask about, do you consume alcohol? Well, we know that smoking can cause a low birth weight in the infant, but not the really drastic, dire consequences that alcohol can.
So the biggest point is to shake the stigma off and call Mount Regis if you need help and come in and get that help that you need.
Oh, definitely, definitely.
And Mount Regis Center is located on Kimball Avenue in Salem. For more information or to seek help, you can call 540-389-4761 and you can go online to mountregis.com.